Hello students, hope you're all doing well. Um, uh, we have already learned about the basics of psychiatric social work in our previous videos, and we also have learned about various scopes and functions of psychiatric social worker, and we have also learned about the history of psychiatric social work in the West and in India. So today we are going to learn about the changing perspectives and trends in mental health and psychiatric social work. So, psychiatric social work, as we have already done the introduction part before, again we will do it. That psychiatric social work is basically a specialized branch of social work which deals with theoretical as well as clinical work and the knowledge of psychiatry. It primarily deals with the problems of mind and associated disorders of an individual. The essential purpose of psychiatric social work is to help the people with problems of the mind and or with behavior problems, or we can say precisely the problems of mind and brain and their solutions. So the historical analysis of the social work profession shows that its involvement in mental health field has started during the early stages of development of the profession. And the following slides discusses in brief the positive and negative factors that facilitate or hinder the profession from appropriately adapting to the current service needs of the mentally ill persons and their families and communities, providing quality mental health and social services to this population and society as well. So first we'll deal with the negative trends which are going around so far. And the first one being the less importance to mental health. As we all know, very few of us give importance to our mental health, and most of us who, does not even care about our mental health. They feel that if physically they are fit, but actually it is not. You have to be fit for both physical and mental health. So this is being one of the most dangerous trend actually, that many more than 90% of the people have give very less importance to mental health. And next one is less funding, which we generally see in psychiatric social work setting, that in NGOs or in any GOs or IGOs, we see that there are very less fundings going on for for development of mental health or for care of mental health. So that is a negative trend which we can say not only in India but also in the world, due to lesser importance in mental health. Lack of communication is another factor where many of the individuals, while doing counseling, some of them they just go off and doesn't return, right? So if you are having at least 100% people as clients of yours for counseling, then at least 50% of them does not even respond back for a second session or a third session, right? So that happens, that lack of communication happens, which again gives rise to further mental disorders, right? Demotivation. So another very great factor is demotivation, where basically seen in India, that many of the people, many of the students actually, I'll tell that they feel demotivated to study psychiatric social work or psychiatry or psychology for that matter. Basically, most since these areas are not very financially equipped or financially settled kind of areas, it's more towards the humanistic areas, right? So people generally go for the the more trending courses like MBA or engineering. So that's where people gets very demotivated. Even in the case of MBBS and MD, where people generally do not take up psychiatry. Actually, they will go for other, being a surgeon or a cardiologist, radiologist, everything, but not a psychiatrist. So that is also a very motivating factor. And what it gives rise is that the competitiveness becomes lesser, and there are very less psychiatric social workers or psychiatrists or psychologists in India that can give more importance on mental health of people. Next one is the pay scale. We generally see a lesser pay scale in these fields. both in medical and psychiatric social work, for that matter. But slowly the trend is changing nowadays, and where with lots of patients getting both physically and mentally unfit, or I would say dysfunctional. So at that times, more and more psychiatric social workers are getting hired, and it has, even though it is a negative trend so far in India, still it is on a rise. Yes, this the next point is less appreciation, where very less people are appreciated for their work in psychiatric social work or medical social work, because again, I would say this is not a mainstream kind of a job, right? Then we have role clarity, where where people or psychiatric social workers or psychiatrists or psychologists lack role clarity, what they actually have to do. Only counseling and assisting the client is not the only thing. Many people do not even bother about follow-up or referral services or follow-up services or home visits, right? So even those are actually important for the well-being of the client. So that is where the role clarity comes in. If you are clear with the role, then you can go in a higher position. Next is education, where I would say there are very less students these days in both medical and psychiatric social work, and as the trend is, as more of HR oriented, where people will generally prefer HR over MNP and CD specializations. So even in education, this is a negative trend. Then high competition with other health professionals. Yes, there are high competition with other health professionals, like the psychiatrists, the psychologists, or other health workers. So it becomes a more competitive and lesser pay scale. So again, it's a negative trend. Then again, it's a less supervision. Yes, because less supervision in the sense, in a very few places you will get very good superiors or supervisors, where you will learn so many things. But in very specific spaces you will get. Otherwise, many of us do not even get the proper supervision to become a psychiatric social worker, or psychiatrist, or or medical social workers as well. There are some positive also, the positive and changing trends which were cited by NASW, that is the old hierarchical method to teamwork method. So basically, there was a system of old hierarchical method before, where people will only go to the doctors and not the other health professionals like psychiatrists and psychologists or physiotherapists. So now it has become a teamwork method, where if you have to go to the doctor and if you are referred for a mental health disorder, then you are going to work with the psychologists or the psychiatrists or even the psychiatric social workers. Next is the importance of case management, where casework becomes more important these days. Individual problems, working with individual clients, that becomes more important. Even I would say group work is also very important, and same with the community organization, where these slowly these are getting in importances. Next is research and evaluation in the education and professional practice, where we find so many researches going on towards medical and psychiatric social work these days, in both education field and both professional practice field or counseling field. Then there are introduction of new models and techniques and therapies, like recently DSM-5 and ICD-11 has come into place, where you can see a lot of disorders being added. Okay, like gaming disorder was in ICD-10, gaming disorder was not included, but here in ICD-11 it has been included. And and there are so many other techniques and therapies which has come in. Before only CBT was used, but nowadays so many other therapies are used, right? Or REBT and their inner child, all right? So many therapies are used these days. Next one is the main focus. The main focus has been the primary focus has been in health education in psychiatric social work, both physical and mental health. Next one is the health promotion, where both physical and mental health are promoted by various endorsements. Okay, then disease prevention. Yes, any kind of disease for that matter. It may be physical or it may be a psychological disorder. But the as we all know that prevention is better than cure. So lots of awareness programs are coming in from both the government and non-government side for disease prevention. So, these all slides show that the changing mental health environment and the challenges faced by social work, and it stresses that the profession must adapt to dramatic changes that have been taking place since the advent of deinstitutionalization and a need for community care for mentally ill persons. So it has been seen that in psychiatric social work, it's a very practice-based profession, right? And a very prestigious area of practice as well, and actually very highly respected. So it becomes a challenge for us to deal with several several dramatic changes that has been taking place since its advent, and again it will change the course of action soon, and it will be on the rise. So people have actually started caring about the mental health, and in this corona pandemic, everyone has somehow become depressed or somehow become angry, or some kind of emotional I would not say disorders, but some kind of emotional disturbances have turned up, right? So yes, everyone has slowly and steadily started to care about their mental health. Historically, social workers in mental health field rarely challenge the dominance of psychiatric profession. This position seems to have restrained social work from providing its full potential and contribution to this field of practice and to the population itself. So the assessment of continuing problems and current issues of the mental health system shows the potential central role of a social worker in this area. However, changes must take place in the practice of social workers in the mental health service system, as well as in education and training of social workers. So these are some of the changing trends we can see from this chapter. Again, we are going to deal with a lot of other, Indian views and various other disorders in the coming chapters, about which you will come to know in depth. So stay tuned, and please, prepare your, doubts and questions so that it can be answered in our next classes. Okay. So thank you so much for listening. See you in our next video. Thank you.